6:40, and tonight, UConn women's head coach Gino Auriemma is isolating at home after testing positive for COVID-19. The positive test result coming just days after Coach Auriemma got his second COVID-19 vaccine. And tonight, obviously, many people are wondering how someone could have tested positive after being vaccinated. Joining me now is Dr. David Banach from UConn Health to talk more about that. Dr. Banach, you were with us at 4:30. Now at 5:30, we got to get you on the payroll here.
Thanks for having me.
We appreciate it. So let's start with the obvious question and concern. Gino tested positive, but had recently gotten his second dose. I believe it was on March 10th or March 11th. Why did the vaccine not protect him?
So, I think it's important to really understand how these vaccines work and in terms of generating that protection. So, you need to give the body time to be able to generate those antibodies and those protective immune cells. So, what the general guideline is that for up to 14 days, you haven't quite reached that level of protection. So that's 14 days after getting your second dose for the Pfizer and the Moderna vaccine and after the single dose from the J&J vaccine. So it sounds like Coach Auriemma was still within that window and hadn't quite reached that full level of protection. So, I think it just reinforces the need that we have to stay vigilant during that 14-day time period and still stick to those precautions until we get that full immunity.
So for people watching this who are saying, oh my, does the vaccine not work? How did this happen? And obviously we understand he did not meet that 14-day threshold you just discussed. For those people who maybe this is making them more hesitant about getting the vaccine, what do you say to them?
So, I think it's really important to understand the effectiveness of these vaccines. So, these vaccines are extraordinarily effective in preventing severe infections. Infections that require hospitalizations, and that's the most important piece. They are also effective in preventing milder infections and even asymptomatic infections. We have that data from the studies that have been done since the vaccines rolled out. So, I think, they were never claimed to reach 100% efficacy in milder disease. Even those individuals who were vaccinated, I think there is some protection from progressing from mild infection to more severe infection. So, I can't speak to Coach Auriemma's specific situation, though I've heard that he didn't have symptoms when he was tested. So there may still be that benefit from progression, if from keeping him from becoming sick. So, I think these vaccines are going to be critical, both for protecting individuals, but also in reducing further spread of the virus in the community.
And you are correct. Coach yesterday saying that he has been tested every day, had never been positive, and is asymptomatic at the moment, which could be a credit to the vaccine. In general, to round things out here, what do you think is the biggest takeaway from this? What do you want people to know after hearing this story about Coach?
So, I think there's a couple of key points. First, COVID is still out there. We've done a nice job in bringing rates down, but there is still COVID that's spreading. So I think we have to be aware of that. As we think about our day-to-day activities, I think it highlights the need of the vaccine to prevent severe illness, and I think the data supports all of that. But then really highlighting the need for that 14-day interval of maintaining full vigilance and protection until you reach that point where you're considered fully vaccinated and have that high level of antibody and protection. So I think those are some of the key messages. I think the data that we're seeing from these vaccines here in the U.S. and other countries is showing a tremendous impact in reducing the spread. And I think, as more and more people get vaccinated, we'll continue to see that benefit. But the key is to get people vaccinated and really do that to protect ourselves, but also all those around us.
Always appreciate your time. Dr. Banach from UConn Health, thank you so much as always.
All right. Thanks again for having me.